No. To turn this into a video. So what we're going to do is talk about dimensional analysis. I'm going to talk about my experience with that when I was at LaSalle University. That was quite some time ago. I've been at Drexel now for 10 years. I actually conducted research on the topic. My dissertation actually was on dimensional analysis. So I'm just going to move forward. I just have some beginning slides on information. I hope you all received the PowerPoint. I sent that, not the PowerPoint, pardon me, the PDF of today's presentation. But I am going to make, as I said, a video out of it, and I'll be sending that to you as well, especially for people that were not able to attend. Now, when you look at the number of medication errors, we're all familiar with the fact that this continues today, despite the first IOM study in 1999 and further studies afterwards, and the cost of those medication errors. There have been numerous articles, they continue till today, of the fact that really our nurses have poor calculation skills. However, I have to tell you, there's very few authors that actually do provide solutions. We're very good at looking at the problem and saying that it does occur. Now, there's a number of reasons, and it's been very frustrating for nurse educators, because often what we do is we hold to our tried and true medication calculation methods. So what we do is, the ratio proportion formula, we were all raised on it, and that's what we were familiar with, and we continue to teach that particular method. Or it could be that our pattern of teaching this method, maybe we're just not good at teaching medication calculation. Also, students have a lack of medication calculation practice, especially what we would call the real world. You go to pediatrics, you can't do medication calculations there because you can't give meds. You go to psych, you can't give meds there. Maternity, I think the best you might be able to give is a colace, maybe an injection or two on the mom if she's not breastfeeding, but other than that, not too much. So you can see, and even on our units now, medication administration has become really complicated depending on how many pages people have to go through, and I mean computer pages, in order to click off meds. I had one of our clinical educators show me several years ago when I was still teaching in the undergraduate program how difficult it was just to sign out the fact that she was giving insulin. And so all of our students don't get to give meds every day, and so that decreases their calculation skills in the real-time world. Now, the causes for all of these problems that we have with our medication calculations is because unique to nursing, but not so unique because chemistry has this same issue. They have different measurement systems as well. Atoms, moles, and I don't want to remember anything else from chemistry. I don't know about you, but we have the 3 different measurement systems. I believe you're probably still teaching the apothecary system, even though the Institute of Safe Medication Practice says we should get rid of it. The problem has been, and I believe it still continues, that some nursing Council of State Boards of Nursing or NCLEX exams still might continue with that particular measurement. We have 48 variations that exist for setting up a drug dosage calculation problem, and that is only when you use the ratio proportion and also the formula method. 48 different variations, one study showed, of the way that various faculty were able to set up these problems, same problem, and teach it to a student. We also now have unit dose packaging, and this again decreases practice with calculations. It's right there for them in a pre-filled vial or a bag of solution, for IV antibiotics or a tablet. And then I talked about clinical agencies. Also, practice throughout a program of study should continue, and also following graduation. There's also something called math phobia, and I know some people believe they have it, other people scoff at it. However, Sheila Tobias is a researcher that did work with this and actually found that such a thing exists. Particularly, she took a feminist pedagogy approach, particularly among women. Now, the drug calculation dosages errors are cited as one of the most frequently occurring types of medication errors. So it's the calculation of those doses. And it occurs despite the fact that we use calculators and we have a unit dose system of medication. Now, the most common cause for those calculation errors are arithmetic errors and setup errors. Now, we have the three basic methods for doing our dosage calculations. Many books will contain all three: the basic formula method, the ratio and proportion, and the dimensional analysis method. I just want to stop here and say that the dimensional analysis method, I kind of mentioned chemistry. When they would go between their measurements, between atoms, moles, etc., they previously used the basic formula and also ratio and proportion, and they found their students were having problems with this. They recognized this, as we did 20 years ago. They instituted dimensional analysis. You will not find a chemistry book as of 20 years ago that contains basic formula, ratio, proportion. They just wiped it out, and they went with dimensional analysis. So our students who have had chemistry already know how to do this. They may know it as a different name, and so we'll talk about that shortly. This is just showing you the basic formula. Doesn't that look easy for you know, how to do a desired dose over what you have on hand, etc., in order to get your answer. Here is your ratio proportion method. I do have to admit this was always my particular favorite method. This required cross multiplication, and then, you know, really the method that you chose depended on the type of problem that you were trying to solve. And sometimes the ratio proportion and also the formula especially could really get lengthy as to the number of processes you had to go through, depending on the number of conversions that you had. Now, the dimensional analysis method, it does consist of multiplication of a series of fractions, and I'll show you what that looks like, in which the numerator and denominator contain related conversion factors. It's also been called factor label method, conversion factor method, unit analysis, quantity calculus. Stoichiometry is another word that the chemists use. This is the formula for dimensional analysis, and so the first thing that someone has to do is over on the left they're going to choose from the problem what is the given quantity. Over on the right they're going to put what do I want to know, the wanted quantity. What do I know about that? Is it milligrams, milliliters, or what? And then I begin to fill in any conversion factors that there may be. And so I put abbreviations here for those particular names. Now, the difference, and I suggested to everybody, and I'll talk about that also shortly, the book by Gloria Craig on dimensional analysis. She was actually the first book to come out. I believe the first edition was 1997, but her original work was done in 1995. I did my dissertation in 2000 using her work. She does not set the problem up as a multiply, 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 as you may see some people do. She uses kind of, if you remember diagramming sentences, she diagrams the medication calculations this way. I believe that once you start having people putting in multiply by, multiply by, multiply by, that sometimes can create an error. Now, the benefits of dimensional analysis is the ease of instruction. You have this one formula, you memorize 5 steps, and you can solve any problem all the way from figuring out how many tablets to give, all the way up to how many drops per minute you should give of a drug. You can figure out any pediatric dose per milligrams of kilograms, etc. So there's no need to memorize several different formulas. You memorize the 5 steps, how to set it up, that's it, and you're done. There's also a neatness of setup that you have. Now this was the textbook that I alluded to earlier. This is by Gloria Craig. She does have an interesting background, just real brief. She started out as an LPN and for a number of years now has had her doctorate in nursing. So she went step by step all the way up. She herself, and she wrote this, she used to write this in the prologue of her book. I don't know if the 2015 edition has it. What she states is that she had problems. Another registered nurse showed her this method, and she began to love it. It was the only way she could do medication calculations, and so she stuck with it. Now, here's some of the research, and you can go through these articles. Craig actually did her dissertation on dimensional analysis. She then joined with Sellers. There's an article. Then what followed was my dissertation. Nothing was written on this in nursing from that period of time. Rice and Greenfield and Craig and Sellers are probably the most cited references for dimensional analysis. I looked up and I wanted to see what has been done recently, and I only looked at research studies. Middleton, Coates, and then the last group of people. What you'll find in the research, folks, is there isn't a statistically significant difference if you teach one group the dimensional analysis, and they usually call that the experimental group, and then they also have a group that they call the control group, and that would be their ratio, proportion, and formula method. And they usually do a t-test or an ANOVA, matters not. And what they do is they look for statistical significance of between pre-test and post-test scores to see if there was a statistical significance between the two groups. Usually they find out there isn't. But what they do find out is that those that were taught by dimensional analysis, and this was found, I believe, in all but the last study, they did not find this. But that's one study out of how many that were ever done on dimensional analysis. But what they find is those taught by dimensional analysis, their post-test scores were definitely higher than those if you looked at like the mean average score. Now, the lessons learned, Middleton did a very nice study, and I have to say I agree with her on her particular concepts just from my experience. When they did their study, they said, you know what, we've learned a lot. We didn't have statistical significance between these two groups. However, we have found that really all faculty members, including the adjuncts, need to be oriented to mathematics program that you're utilizing in dimensional analysis. And they really have to understand the fact that everybody has to use this. Now, I will tell you that at LaSalle, I did come across this problem. Some people were very much adapters of the system. Other people said, you know what, I don't know how, even though they were given the book and they were given classes in it. I don't know how, I don't want to know how. I know ratio, proportion, and formula, and that is what I'm going to show you. So they can't show students the my way, because then that becomes very confusing if you really want them to use a standard method. And that is what that last study, what the study, by Middleton in 2008 was showing. It was really showing, you know what, if we have a standardized method, we are seeing that that standardized method being dimensional analysis really supports the fact that students do better. You also have to give, they said, students enough time to learn the process and Because if you try to rush medication, calculation, learning, then what happens is they really get scared. And they feel that they don't have an adequate time to practice. And we should not expect that all students are able to learn this content on their own. Now that may sound strange to you. There are, when I was doing my study, I was trying to find programs, another program that could be my control group, because I was teaching my group of 40 students dimensional analysis. I finally did have entree. It was hard to get entree into a school because it was actually my dean at the time that assisted me. It's hard to get entree because med math is considered a dirty little secret. People don't want you to know how they teach it, or the fact that they don't really spend that much time teaching it. And some people, it's self-learning. They have self-learning modules, etc., and so that there's no interaction with the students, with any kind of faculty in learning all of this, and that's been a big problem. It's also important to provide repetition. So in other words, via clinical opportunities, classroom exams, and retaining nursing mathematical processes helps to promote concept acquisition. Now, here are some suggestions that I have. Looking at the work of Benner, and that, not the novice to expert, though she's very much attached to that, she has been talking a lot about situated learning. And the way that students really can learn is if you put it within a context of a real situation. And so some ideas that I have here that actually go along with this and help students to learn. Having visual problems. So when they're learning, they actually have the IV bag, the drugs, any equipment, syringes, etc., that they're going to need. Virtual problems generated by computer. And some of the textbooks also have this attached to it, where you can get this. There's also freestanding, you purchase it, virtual problems that are generated by computers, and students can sign into that site. Also, using it in simulation. It could be brief simulations. You can also use virtual simulation. And I was doing some looking up last night. I'm really into mobile technology and using all kinds of technology. Anything that the millennial students can really hook something onto. So I found this MedMath app, and that's down on the right-hand side. If you go into, say, the Apple Store for apps, I finally was able to find one. This was actually recommended also in an article. Now, for gaming, and over on the left-hand side at the bottom is a game that you can actually, if you go to learningnurse.org, you can use this. There are also other games that are out there for MedMath. I suggest that in the virtual land of reality, that what you can do is actually have syringes or vials or something like that that you can actually, and you can see this is over on the left-hand side, there's a dark pink shading, and then there's a purple at the top. You can actually increase this on, say, a syringe, and this is showing 0.9 milliliters, which of course shouldn't have the 0 behind it, but we won't point out that MedMath error. I did notice that Google Play also has some interesting games, etc., and apps that students can download. And then I'm thinking Twitter anyone. You could also, faculty could tweet out a MedMath problem of the day. They could do it on Clinical, because you can do this on iPods as well, iPads, etc. Now I just want to stop for 1 second and look over. Let me see. Marianne said that she found that having virtuals like IV bags and med bottles in the classroom has been very helpful, and you can get them from Robin. Okay. who, of course, is in the lab on the 3rd floor. I used to always bring those in as well, even the medicine cups. Bring in a bunch. I'd pass them around to students. They absolutely loved that. And actually, dimensional analysis is based on the learning theory of David Aufbau. His belief, it's a cognitive, the way we think. He believes that you have to use information that you've learned before in order to hang your coat on, hang your hat on, if you will, and learn something new. And he believes in giving advanced organizers to students. So if you think of a concept map where we give students the blocks, if you will, on a page to fill out a concept map, that's what Gloria Craig is doing here with her diagramming. It's an advanced organizer. Now, for the curriculum, oh, I see someone else likes Ausubel too. He was my theorist for the dissertation, but enough. The curriculum that I used, you could, within the 1st quarter, with reinforcement throughout the program, teach the 1-factor, 2-factor, 3-factor. That is how the book is divided. And I taught it all in one semester. I dragged it out for the semester. I had practice every week. It was during the fundamentals class, which would be our foundations of practice, but I know that we're changing to a concept-based curriculum. The only thing with this is it has to be reinforced throughout each of the different courses that you would then have. But all of this is taught all at once, and then students use it. Now you can see here are the 5 steps of the dimensional analysis. And so all they have to do is, memorize these. They go on to the left side of the diagram. You want to identify the given quantity. Then you identify the wanted quantity all the way over on the right. And I'm going to show you this on a diagram. This is a sample problem. It's showing you that what's ordered is morphine sulfate, 1.8 milligrams IM stat, and the supply is that you have 2 milligrams. Now, unfortunately, when I copied this onto this template, it didn't work out so well. But the dimensional analysis, let's just say, however we get there, which is the 0.9 milliliters, that you can see that easily, and these lines that I have, I was trying to make the diagram, so pardon me. So it's 1.8 milligrams, then there's a line down. Then it's 1 milliliter, okay, is 2 milligrams. So I can cross out milligrams and milligrams, and then I circle the milliliters because that is the quantity, okay, that I want, milliliters. I want to know how many milliliters to give IM. So I've already placed milliliters all the way over on the right before I know it's 0.9. And now I'm going to put my conversion in. Okay, so there's one conversion. Okay, and then what I do is I multiply 1.8 times 1, and then I have my 2 milligrams. I carry that over. I divide it into the denominator, into the numerator, and then I have my 0.9. Now, if you do it by ratio proportion, if students don't set this up nice and neat and go all the way down, and if you see them scribble on a pad of paper, you can see how this can easily occur. This long formula for ratio and proportion can go fairly long down the page. This is a simple problem. And the same thing for the formula method. It can go all the way across the page. Again, this is a simple problem, and the formula method is not looking too bad when compared with dimensional analysis, but they get quite different as you go along. Now, I force students to use the circles. I saw you saying that. That's what Gloria Craig does in her book. And I force them to do that, and I tell them, do not ever get away from it, because then you know what you're looking for. Students often have problems with what to put in the numerator, what to put in the denominator, and I really feel that this helps. Now, my goal here was not to teach you how to do this, but to give you an idea of how to set up the curriculum. So the one-factor problems, just to mention, what I'm trying to show here is the diagram that Gloria Craig uses, but at the top I wanted to name them. So this is the given quantity. We have 10 grains. We then want to know how many tablets we need, so that's over in the wanted quantity. And right away I know that within my conversion, I know that 1 tablet is equal to 5 grains in this particular problem. And so now my computation, 10 gets divided by 5, because I have both of these, okay, in grains, and I would cross them out. Now, this is showing a problem now with one factor problem, and what they're saying is, okay, I have Advil, 400 milligrams, I'm going to give it every 6 hours. I like to throw those numbers in too, and I tell students cross it out in the problem if they're doing it on paper. Otherwise, just write right inside their diagram here exactly what they need, because that 6 hours will throw them. Okay, we're just looking for 1 dose here that they're going to need, and that's how it looks when it is set up. And this is another one-factor problem. That's how it looks when it's set up. And now I'm getting into half grains. That also throws students because they don't know what to do with that 1/2. Okay, and so we see that 60 milligrams is 1 grain. We keep that 1/2 there. And then we see a tablet is equal to 15 milligrams. Now look all the way over on the right. Okay, I'm looking for how many tablets. Okay, so still I have my 1 conversion factor, and then I have my conversion computation. Now I have a number of these. The 2-factor, that I didn't put them all in here. The 2-factor medication problems, they have a specific amount of medication based on weight of the patient. These could also include reconstitution of medication required prior to administration. Of course, so many of our meds come pre-mixed. However, if they needed to do that, that's there. Specific amount of fluid to be delivered over a limited time using an IV pump, delivering milliliters per hour, and so on and so on. Now, this is a particular problem, and this would be what we would consider a pediatric problem, wouldn't we? Because we would say, okay, this is how much the child weighs. I'm going to fill in all of the factors so that the conversion factors go in the middle, given quantity to the left, wanted quantity to the right. And then here's another, and that had to do with reconstitution. And then we have our 3-factor medication problems. We often think of these as the critical care ones, for instance. Okay, calculation of a 3-factor given quantity to a 1-factor, 2-factor, or 3-factor wanted quantity. Problems usually involve maybe a weight of the patient, a time required for safe administration, or IV fluid, and IV fluid, reconstitution or preparation of medication. So let's see what we have. Say we're giving Tagamet, and it's based on milligrams per kilogram. So now we have 3 conversion factors. And also, say, a dopamine or dopamine IV drip. You could solve that problem. And so I'm going to stop now, and I'm really going to ask you if you have any particular questions. I'm going down through the chat. I see, is there a rationale for the wanted on the right? Okay. That is a good question. The wanted is on all the way over on the right, and what Gloria Craig does is she wants students to actually establish what do they have on the left, and then all the way on the right, what are they looking for? Are they looking for tablets? Are they looking for milligrams? It is solely for the purpose of setting things up so they cancel out, but you know that right away, whatever you have as a conversion in the numerator has to be the same as what you have for the wanted quantity on the right. So if you're looking for milligrams, then the conversion factor when you put in, say, I'm trying to think, a conversion from grains to milligrams, let's say, then you know your milligrams has to be on top. Now, you know what it also does take? I see someone saying that they're not getting this yet, and you won't. This was just a basic, really talking about how this was done at one school. I've also looked into the literature for a number of years, how it is done at other schools. My particular feelings on the fact that students kind of get this because they've been taught it in chemistry. I had to teach myself dimensional analysis. I have to tell you, I'm not the kind of person that learns by reading directions. It was painful. But it was for my dissertation, and so what I did was I taught myself as I was teaching the students. That's exactly what I did. So when I was teaching, you know, the one-factor analysis, I used the book and taught myself. The book is easy. I have to say. It's easy to learn from. If I could, anybody can, trust me, because I am also not a math wizard. Would a question regarding how long would a bottle of medicine last be considered a three-factor question? Oh, I do not know. Marian, it depends on how many. I don't think so. I don't think it depends on how many factors, conversion factors you have. See, this is all done because of the fact that students have conversions, because we have apothecary and we have the metric system, etc. So we have, you know, 3 different systems that we work with, and so we have to go between those and convert. So it would depend on how many things, you know, how much was in the bottle, you know, that type of thing, the numbers that you gave them. We also convert minutes and hours and things like that. So that would depend on that. Yeah, the 3-factor, you really, what I did was, it's coming back to me. I broke that down. So I did similar. Students really like repetition. I do too. So if I'm going to do the 3-factor problems, I'm going to stick with the same type of problem all the way through. So if I'm teaching them, let me see, like you would dopamine drip, adobunamine drip, etc., because they're all in, say, micrograms per kilogram of body weight, then I would keep repeating those. Then I'd go on to another type of 3-factor analysis type questions. And I would do that. So while I divided it over a semester of 15 weeks, I would spend, say, every so many weeks doing a piece of this. Okay. I did. I started, okay, let me start with the beginning part of that question. I began with, I really had them take her book. And what we did was, I did it according to the book. And so she begins with basic med math. And so I began with that too. But I remember only spending about 2 weeks on that. And then, because, you know, they have calculators that can help them with the arithmetic, and hopefully they use them. That is the #1 issue with medication errors. The next is the setup, which is why Gloria Craig and other people that have done research really want people to use dimensional analysis because it's a one-way of setup. So it takes care of students having problems with, okay, which formula or way of doing this should I use? So then what I did was I spent the next couple of weeks in class, and this was usually at the I would spend, like, say, the last hour. I had a 3-hour class once a week for fundamentals, and so I'd spend the last hour of class on medication calculations. And they would have homework, and some of this I would also do. Like we have Blackboard, I had developed their Blackboard use as well, because this was years ago. This is when people were not using, we used it from the book company, and with all of the things that they had to offer. So our fundamentals text was there. So I would have them do certain problems, and then I would open up what the answers were and that type of thing. I always gave a separate mid-math quiz because if you put it into another type of quiz, students can get the mid-math problems wrong if it's a quiz of all of the knowledge that you're teaching in your fundamentals course, let's say. So I taught, they can get those questions right on the fundamentals and then get all the mid-math questions wrong. What I also did was then I spent the next few weeks explaining dimensional analysis and just having them do factor 1. So that was like the first class on dimensional analysis. And I spent some time really on the easy ones. Then we moved up to the 2-factor. And then the last few weeks was on the 3-factor. The only thing is each class after that has to make sure that they stick with all of those. For instance, the pediatric type questions, I taught them how to do that. That has to, it's kind of like personal days. If you don't use it, you lose it. So I had them do set problems because I taught them in the next course, Med-Surg course that was in the spring. So I would have examples of each of those, and we would continue having quizzes and having practice that could be put in a Blackboard course shell, and the quizzes would be in-class quizzes. How well was the standard accepted by faculty overall? I have to tell you the dean was a big supporter of it. There were faculty that did not want to teach it, weren't going to teach it. But you have to understand dimensional analysis. My dissertation was in 2000, so I was doing this in 1999. People really had not heard of dimensional analysis. It was considered some crazy idea, maybe a fad that would go away. And so some people did not accept it very well. And I will say even full-time faculty. So the full-time faculty member, who is one of my best and dearest friends, she was teaching what would be the Adult Health 3 course, or critical care if you want to call it that. I tend to think of it as acute care right before students graduated, and she was just not going to use it. And so, when she set her mind to it, that was it. So you will get resistance. The same thing with adjunct faculty. However, I will tell you that what Middleton found in her study in 2008 was that actually a benefit of this was that students were teaching RNs on their unit how to do it, because once they learned it, they were enjoying it and found it to be easy. I have to tell you that I had an adjunct faculty member that taught in fundamentals, and she was actually teaching the nurses at Penn. She worked in their SICU, and she was teaching them how to calculate drips using it. Now, I know that in hospitals, and students may say this to you, that they also have, let me see, programs on the patient computers that will calculate this for them. And they will also tell you they can do it by different apps they can put on their phone. These are all tools that can be used. However, we have to have a conceptual understanding of what is going on, or we're not going to understand what we're giving our patients and making med errors. Oh, that's a very good, I like that. I'm sorry, I'm reading, you have an Excel spreadsheet that does it for you, but the lights went out, and so what do you do then? Yeah, exactly. And this is with many things. You know, when I teach students fundamentals, when I would be on the unit, I did not want them using the Dynamap. You know, because then they wouldn't know how to take a blood pressure using a cuff. What do they use in home care? You know, sure, you know, you can use a cuff that blows up, but, you know, how about when you have a really sick patient and they're on your med-surg unit and you're starting to not get a blood pressure? I would find that people, RNs, who didn't know how to palpate a blood pressure, etc. Again, some of the touching and feeling of knowing how to care for your patient. Now, I guess, how well was the standard accepted? I'm seeing something here about, I mean, beyond the official math lectures. So I'm not understanding what that is connected to. I'm hoping I've answered the question. I'm going to stop for a minute. If anybody wants to chat within the chat box, send a question. Oh, thank you. Yes. How to maintain a friendship and two-dimensional analysis is what I call it. Let me see. Any other questions that folks want to ask me about that, you know, via the mic or via chat? And you can just click on your mic and talk. Yes, there are YouTube videos. I did find one. I meant to put it in here. There are tons of them. I will send you, actually, all of you, what I thought was kind of one of the best. This is something else. I meant to also put it in the slide for technology. This is also something, students love YouTubes, you know, so that could also help them as well as help faculty. Okay, Marianne has here, when you do safe dose ranges, do you place all aspects of the question in one DA problem or in several? First, calculate the low dose. I put it all in one problem, Marianne. And this, because that's how the student will get it. When you have to calculate, you know, the safe low dose, the safe high dose, and then compare and calculate how much to give. I put it all in one problem because then they have to realize how to set it up. Like I said, I start out with the easy problems and then work my way to the more difficult. And when I work my way to the more difficult, I put in, just as the problems that Gloria Craig has in her book, information that they don't need. You know, like you're giving the drug every 4 hours. I don't need to use that number in particular, perhaps, in that particular question. But the students have to figure out then, what do I need, what don't I need, because that's what they're going to be doing in real life. That's why I really like the situated learning and giving them real situations. Actually, there is some research with doing med-math, not a specific method, but med-math with simulation, and students did learn to do this better when they had simulated situations. And I really feel, again, it's because it's more real life. They're actually getting to feel, see, and you know, hear this, you know, what's going on around them. Any other questions, folks?
Joanne, this is Maura. Do you think the students had a students had a harder time when you didn't set it up like as a math equation, like when you just used the boxes, sort of like a dissection?
No, because that was the way she was doing it in her book. So in other words, it was all set up in the same way. They see it that way in the textbook. They see that way when I would teach it, and then that's the way they would get it. They were expected to do it in a test. Now, I did have some chemistry students, some students who learned this in chemistry, who would, they wouldn't want to use the boxes. They would want to use the, the given quantity and then put the times, then put another numerator denominator for a conversion factor, then put times, then, or equals their conversion, what's their conversion computation. If they were used to doing that in chemistry, I let them do that. But I tried to really remain with what were they seeing, making it standard. Making that, so that they saw what was in the textbook, etc. More, did that help you?
I actually do a version of this, but I put everything on the left. So I start with what I want, so that when I set up and then I make them write out every single conversion that is possible in that equation. So whether they don't know whether they're going to need it or not. And so when they set it up and they have what they want on the left-hand side, and if they want milliliters, I know that I'm going to pick the conversion from my list of conversions that has milliliters at the top and start with that. So that kind of helps them.
Now there's okay. There's more than actually, and they show you this in the book. There's more than one way to set up the middle part of this, how you do the conversion factors. As long as the student gets the correct answer. So in other words, it doesn't matter what conversion you put first. If you have to do more than one conversion.
Right, but I had them. The reason why I did that was so that if they at least they selected the it didn't matter which conversion factor they picked, but as long as they picked the conversion factor that had in the numerator line of it the same unit of measure or tablets or that they needed at the end, so that they wouldn't inadvertently, transpose or put the wrong equation up there, like have those things that they desired ultimately at the end in the denominator of the equation to be crossed out. Do you know what I mean?
I do know what you mean. Did they have a problem with that?
I think I had like 6
steps.
Like you say 5, like there were 6 steps. But I started with 7 steps, and by the end we had pretty much condensed it to 5 or 6 steps. So.
Okay. Let me see. I'm seeing something that's typed down here. Let me see, Marion, I find the main thing they struggle with is what they need in the problem. Yes, that's very much so. And what they don't need. If they are given more information than they need, like in reconstitution problems, absolutely. And that's where also I think if they get to, it's different when you're seeing words, but when you're actually seeing, a simulated type of experience, when you're actually getting to see vials, etc., that makes sense to them. Now, there are also, and it's hard to get everybody into a simulated experience in a classroom or in the lab, but there are virtual experiences, computer experiences, where they can actually pull a syringe, pull a vial, by using, little play syringes and that type of thing. And I think that also helps. It's a visual, so they can actually see the amount that they're ending up with. I also like to go back and ask students conceptually, does this make sense? Because you know you're going to have students that will get, I should set the IV drip to 1,000 drops per minute. Okay, but does that make sense? Could you even time that? You know, could you put that on a pump? You know, does that number come up? So those types of things I think are helpful. Anything else? Ah, good, Maura. Yeah, that's your final step. Yeah, conceptualization of the whole thing's so important. Well, folks, I'm going to go because I do have a meeting in 5 minutes. I am going to send this audio-visual for you. I did do Marianne classwork each week. They had 10 problems that they had to work on. I gave them a week to do them, and then we would work on a few in class in small groups, and then also I would have them do, say, a homework assignment as well, where some weeks I would just post the correct answers. And they would come in, it's kind of like your muddiest question, you put it on an index card. Which problem did you have the hardest time with? Everybody would give me an index card, and I would only concentrate on maybe number 2 and number 5 out of the 10 questions that we would really review. Okay, so I will let you folks go, and I will send you the audio-visual of this. Okay, thank you. I hope I was able to help you.